Kristian Ranta lost his brother to suicide, and that is obviously devastating. But for Kristian, it really forced him to look at the world of psychiatry and ask, why did this happen? Why was my brother, who was in the system getting care, not get better, but why did he actually get worse? And what could have been done better? And the results for Kristian is Meru Health, and now Meru Health Advanced, to really help take care of people who are treatment resistant, who have metabolic comorbidities, and doing it better than what you can say, quote, traditional psychiatry practice does. And we really have to take a step back and say the way our medical system as a whole, and certainly our mental health system, is the way it's structured, is not optimal. And how can we optimize that? So this is the discussion I have with Kristian today about what they're trying to do at Meru Health and how it really does this multi-modality approach, the holistic approach, however you want to say it, how it really does treat the patients as individuals and helps them have better outcomes. So with that in mind, and this hopefully new framework that could potentially become the framework that we all deserve and all can practice, I hope you enjoy this interview with Kristian Ranta. Well, Kristian Ranta, welcome to Metabolic Mind. Thank you so much for joining me today.
Thank you, Bret. Pleasure to be here. Thanks for having me.
Yeah, I'm excited to get into sort of your whole experience with the world of psychiatry and what motivated you to start Meru and how it's different in terms of psychiatric care. But, before we get into all that, as I like to do, I want to ask you, what do you think is the biggest thing that medicine gets wrong that you really wish were different right now?
Yeah, that's a great question. I used to be in diabetes before coming into mental health. So I built my first two startups or businesses, medical technologies in diabetes. And what I remember from our chief medical officer from back in the days, he used to tell me that he's an endocrinologist and a PhD and an MD. And he said that medical school used to have 1 or 2 hours of nutrition related education on his 10 years of studying from MD to even PhD. And then I think that was something which was an eye opener for me already back then, that I realized that wow, that's pretty crazy. Diabetes and no nutrition education, what? And then, so I would say that nutrition and what we eat, the input, I'm also a very logical thinker. So input and output, the input, food, diet, I would say that's what I think is the biggest miss in medicine today.
Yeah, I think that's a great point. And so many people you're right, came out of school and training, learning about nutrition as it relates to sort of severe deficiencies, but not to the chronic disease epidemic that we're in. And so that, I think, absolutely 100% medical education and research and treatment and, just the practice of medicine really does need to be geared around lifestyle, nutrition, intervention, effective intervention for metabolic health. So yeah, thank you for bringing that up. And it brings in this whole concept of metabolic health is not one thing, right? It's not type 2 diabetes, it's not fatty liver, and it's not bipolar disorder, schizophrenia. It's all of that combined because so many of the patients have combined comorbidities, which is part of what I think from what I've read, you're designing Meru Health sort of to attack. But before we get into all that, give us your background, your experience with the psychiatry system and what led you to say we need to do something different.
Yeah, I appreciate it. Yeah, so unfortunately, what happened to me was that I lost my oldest brother Peter to suicide back in the days when I was building my previous business. And, and that experience, of course, made me think very carefully, what happened? What's wrong? What was going on? And my brother was actually accessing care. He was getting care, but it unfortunately only made him worse. So, he was basically just given pharmaceuticals, and then unfortunately they didn't really work. And then they had side effects, and then, it just ended bad. So that's something which made me think very carefully, just look into the research. So my background is in medical technologies, healthcare. I studied computer science and information systems in my undergrad and graduate studies. And then I ended up in a healthcare company and then founded my first own healthcare startup and so forth. And then I realized that this is the field that I want to be in, that it's really motivating for me to be able to combine technology with doing good things, helping people live better, higher quality or better life quality and stuff like that. The experience with my brother and then me selling my last company in 2015 made me very seriously consider like, what do I want to do next, and how could I help people like my brother? And that then took me down the path of founding Meru Health in 2016, so a decade ago. And it also made me think that there's got to be a better way than what my brother was getting. And that's when I went into a lot of the research, and I just started like reading and immersing myself. I started kind of understanding, and then I realized that, wow, like we're completely ignoring, the physiology, the biology in mental health care. Like we really don't have any blood work. We're not doing anything like that. We're not like, using any wearables. We're not like collecting any biosignals for most parts. We're not measuring the effectiveness of care. Like even if we have like some, self-report scales and stuff, we're not using them for the majority. We're not actually measuring care. We don't know what works, what doesn't work. So there's just a lot of things that I discovered. And then having been a biohacker myself also for a long time, I knew from my own personal experiences also that if I don't sleep well, if I don't eat well, I may start feeling depressed. I may start like getting these symptoms myself. And then I'm like, well, wait a minute, like these need to be connected. So that's how we founded Meru Health as a whole person mental health company, to not only do therapy or medication, but also include diet, sleep, exercise, even biofeedback, things like these.
Yeah, and I mean, I'm so sorry to hear about your brother, but you're doing so many
Thanks.
amazing things in his honor, and really trying to make a difference in care. And I was reading some of the things that you've written, and you mentioned about this term treatment resistance, that he was labeled as being treatment resistant, and then that's far too common. And then sort of, I don't know, like the thinking shuts down, or the what else can we do kind of shuts down almost. Like, here's our guidelines, here's our protocol. If it didn't work, it's treatment resistant. And I know nobody wants to practice that way, but it seems like the way the system has been set up. So was that your experience as well?
Yeah, definitely. It definitely was. And I think we kind of like accept the reality, like, oh, well, we couldn't do anything, and it's just how it is. And I just really like realized that I don't want to accept that reality. I want to like try to do something else.
Yeah, and I like what you wrote though. Like, I forget if you said 5 years from now or 10 years from now, treatment-resistant depression is going to seem as ridiculous as untreatable type 2 diabetes, or diabetes unable to
Yeah.
be treated. So now we know we can put type 2 diabetes into remission with lifestyle. It doesn't even take medications, and we can control it with better medications, but put it into remission with lifestyle. And so maybe something similar with psychiatric care. So what are the main components that are being added? I mean, you mentioned a lot of them already, but when you look down and say, this is the checklist of things that we're missing and really are going to make a bigger impact in individuals' care, what's your checklist? What are the main things?
Yeah. So I mean, like, I think first and foremost, metabolic health. So, we have to include metabolic health in psychiatry, especially for people who are really like treatment resistant or who have like more severe conditions. And what do we mean by metabolic health? Well, we basically like do blood work. We look at the person's not only psychiatric condition or psychiatric symptomology, but also what's going on the physical health side. So we first have a kind of a like a proper evaluation, a very comprehensive evaluation with an MD, with a doctor, with a psychiatrist, to then understand the lifestyle factors, but also the psychiatric history and so forth. And then we go into the blood work, 30 to 50 biomarkers, metabolic, hormonal deficiencies, inflammation, things like these. And then that helps us formulate a picture of like what's going on with this person, what maybe other chronic illnesses or other issues the person may be having in addition to the psychiatric issues. And then we'll tailor a care plan. We'll introduce a dietitian, we'll introduce a therapist, a care navigator, and a coach to help the person with like a full care team. And very, very important component is the diet, the dietary component. And, in that regard, we have like two main tracks, basically. We'll either kind of go into more like a low carb ketogenic diet, where we can offer that for people who are, suitable, who that, or to whom that could be suitable for. Or then if there's, kind of the other track we call like a general nutrition track, which is more like optimization for, or towards like a Mediterranean diet. So there's, I'm sure, there's a lot of evidence also on the benefits of Mediterranean diet. And that seems to work pretty well for a lot of people, but it's not maybe something that works that well for the more, severe end of the spectrum, and therefore we also have built in the capability of doing low carb or keto diets.
Yeah. Now, if you think about your traditional psychiatry practice, you come in to see your psychiatrist, you've got, 15 minutes probably, and there's no chance to cover all these things in a visit. And if they tried, it would likely be overwhelming, like drinking from a fire hose. So how is what you're doing different? How do you have the time, the feasibility, and how do you keep it from overwhelming people with the amount of information? Because it's all great stuff and it's amazing stuff, but it's got to be done in a way that they can incorporate in their lifestyle and actually make it work, right? So how do you balance those?
Yeah, that's very important. So we first, instead of like a 15-minute appointment, we start with an hour-long appointment. And we collect certain data beforehand. So we even can kind of like spend that hour on not collecting data, but actually like going into what we learned from the data and then collect more data as we talk to the patient. Then after that, we do the blood work, lab testing. And after that, we have another 30 minutes with a psychiatrist to like really go over like, what did we find? What's the conclusion here? What are we going to be recommending? Things like these. And then we bring in the full care team. So in this way, we have more time, more face time with a very capable psychiatrist, and we'll be equipping the doctor with all the data from self-reported, from historical data, but also the lab work data. And then after that, we'll kind of piece by piece start moving forward with the care plan, with all the other practitioners as well, bringing in the therapist, bringing in the dietitian. So that's kind of like how we've staged things so that it's not too overwhelming. Like we kind of go piece by piece. And again, very important point, that's what you're also making, is just the fact that you need to have enough time for proper diagnosis instead of the 15 minutes.
Yeah, that's a great point too. We focus so much on treatment that sometimes we forget about diagnosis, whether it's thyroid or vitamin deficiencies or hormonal dysfunction or whatever the case may be. It may not be like an all-in-all cure, but sometimes it is, and then sometimes certainly could help symptoms as well. But if those are overlooked, then you're sort of really swimming upstream with any treatment you might be trying. But what's
exactly
preventing this type of multimodality, holistic care? What's preventing it from being scaling and being the treatment that everybody gets who has a diagnosis of depression or bipolar disorder, et cetera?
Well, I mean, one of the challenges is the payment infrastructure. So health insurance and employers who are usually kind of sponsoring for most of the healthcare here in the US, the challenge is that these kinds of treatments historically have not been reimbursable. And that's partially because of lack of evidence. I think there hasn't been enough evidence to support some of these treatments. And that's one thing. But also just the fact that the system is also quite slow in adapting, and sometimes it's for very good reasons. Like we don't always want to rush in things in medicine. So there's also good reasons for that. But I think it's largely because of the reimbursement structures and the challenges with the reimbursement structures. And that's actually something which we are excited to see is changing. And there's definitely more and more openness for more lifestyle medicine type of treatments to be reimbursed. But there's also like a lot of just technicalities and the current, especially for the health insurance companies, it's very much about the CPT coding and how do you like kind of fit into the CPT codes. But then there's actually another way that's kind of emerging very strongly nowadays, is that there's all these value-based, outcomes-based reimbursement frameworks that are actually starting to become much more common. And that is, I think that's what I'm seeing personally and with Meru Health, is allowing for reimbursement for some of these treatments much faster than trying to like fit into the CPT coding, more rigid schedules.
Yeah, I think that outcome-based reimbursement is really kind of an impressive wave of the future, and practices like the Toward practice for Metabolic Health or Verta Health or Meru Health that institute this are really sort of paving the way for this, to say, look, pay us only if they get better. Only if we save you money do you pay us. And that just makes so much sense, right? Rather than getting paid for treatment that doesn't work, you should get paid for treatment that does work. I mean, it makes too much sense. Yeah. But you mentioned evidence. So you have a very good point. I mean, you can't just, hang up a shingle and start doing things differently and say everybody should do it this way. You need to prove in some way as best you can that it's effective. But you have a number of published studies from your practice, right? And what have those shown? Yeah.
So we, I'm sure you're well aware of this saying that like strong claims require strong evidence. So it's kind of like that. We started the company initially collaborating with UC Davis and Stanford early on. because we had an idea of a more kind of a whole person or integrative therapy, which we've been now offering for the last 7 years in the market. But we also realized that we don't have enough evidence to be able to, at that point we were kind of guessing, but we kind of knew or guessed that, hey, we'll need to get evidence to be able to get insurance or employers to start reimbursing for this. And we then went to Stanford and UC Davis, and we told them like, hey, we have this vision. We have this product. We kind of built a prototype. We have some early data. Would you be willing to kind of study this with us? And they both said, yes, like this is fantastic. Like we're actually very eager to study something like this. And then we started like a multi-year collaboration where we then ran several clinical trials with them, large single-arm trials, also RCT, randomized control trials, the gold standard. And what we've shown over the years is that the Meru's therapy offering, which is already like more of an integrative whole person therapy offering, is broadly speaking like 50 to 100% more clinically effective than standard therapy or medication for depression, anxiety. And then we've shown that it also, because of the strong behavior change component, that's another thing we've kind of interwoven into our offering, that instead of just doing daily, or instead of just doing like weekly or bi-weekly visits, we actually interact very proactively with the patient on a daily to bi-daily basis, so that we make sure that while in treatment, they are very much like cared for and also nudged. And it's kind of a carrot and a stick. We also like hold them accountable. And these two components, the whole person components and then the kind of behavior change components, have produced like these great results where we see that people get better efficacy, but also maintain the results a lot further than in traditional therapy. And we published 1 and 2 year data, so even up to 24 months post-treatment data that shows that a majority of the gains are maintained because people actually learned a lot of these behaviors and these skills that they can now use even way after they kind of like graduated from our offering.
And is the whole thing virtual, or are there initial in person and then a lot of the virtual support, or how does that work?
Yeah, it's all virtual. So we are a virtual clinic. We don't do any in person or in brick and mortar visits. So it's all virtual via Zoom or video calls, and then we can help people in every state. So we're available in every state currently.
Yeah. Now, I'm curious. I think you're from Finland initially. Is that right?
Original, yes.
Yeah. So how does psychiatric care in the U.S. compare to Finland? I'm just curious. I know nothing about it. And would something like this work in Finland as well?
Yeah, that's a great question. I mean, like Finland has universal healthcare, so it's kind of something that many people know about Finland, that, yeah, there's this universal healthcare system. But to be honest, actually, psychiatry is very overlooked in Finland. So what I mean by that, like that there's very limited psychiatric resources for people in Finland available through the public system. Of course, private, there's, you can always cash pay, but if you wanna go for something inside the public system, there are a lot of limitations, like just being able to do therapy for even like few sessions or like few weeks or something. That's not covered at all. So I think that's a massive gap in the system, unfortunately.
Okay. Yeah. And the fact that your program is virtual, I think can really help, because there are so many people living in areas where you don't have access to psychiatrist or a therapist that's accessible, that takes your insurance, that you can, easily go see and helpful. So have you found that you're able to reach those people who wouldn't otherwise be getting care? Because as you mentioned, like your brother was getting care, he was in the system and still not improving. So, how many others are not in that position to even get care that you can then reach? So have you found that?
Yeah, for sure. I mean, like we're available nationwide, and we've had a lot of people like from places like Alaska, as an example. I just remember one example recently when someone sent us like a testimonial, like some feedback after they had gone through our therapy program, and this person was in Alaska and like very far away. And then, he was saying like, hey, this is like life changing because I was not able to access almost any care here. So yes, I think you're spot on. There's definitely that component that telehealth and remote care can really help people in these locations. And we've definitely seen that in our experience.
And you've mentioned nutrition a lot. So you mentioned sort of like the Mediterranean type approach and then the low carb keto approach. Who makes that decision? Is sort of the patient comes asking for it, or does the psychiatrist decide which they think would be best? Because you're not sort of like a keto program, right? It's not like people are coming to you specifically for keto necessarily. So how is that decision being made? Or maybe I'm wrong. Maybe they are. So you tell me.
So it's kind of a bit of both. So I mean, like we will be, if someone comes in and has heard that like, hey, you guys offer keto for mental health struggles, then we'll of course like take that very serious. Like, okay, hey, you're here for that. And then we'll still do the evaluation, the diagnosis, and have that discussion with the psychiatrist. Like, does the psychiatrist also feel that this is actually appropriate for the person? And then if yes, then we'll definitely offer that. But in case someone just comes in and isn't like primed with that idea, then we will just like run the evaluation. And then if someone is having like metabolic challenges, maybe insulin resistance or other kind of markers that point that way, and then our psychiatrist will make the determination that, okay, like, hey, we have something that could actually help you. Are you willing to try something like this?
Yeah, and I'm actually curious about your psychiatrist, because you existed and you were a clinic before any decision to have a keto offering, or before really metabolic psychiatry had really taken off. So for the psychiatrists that were already working with your program, when the decision was made, we should look into ketogenic therapy, what was their reaction? Were they fully on board, or were some of them skeptical, or how'd that go?
I think at Meru, we've kind of employed psychiatrists that are generally like quite integrative in nature anyway, because our earlier offerings also, it's not like a keto diet per se, but it already touches upon like diet and sleep and exercise and biofeedback. So our psychiatrists were already like, I guess, a little bit different than maybe the sort of like mainstream psychiatry in a way. And therefore they were pretty open. And we've also had them go through like various like new trainings from Georgia Eid and some of the other experts in the field, to just kind of get even a better understanding on like how do we work with these kinds of interventions.
Well, that's great. Yeah. And at Metabolic Mind, we're establishing a community of practice of physicians in this, and of clinicians of any kind in the field. So we'd love to have them part of it. So we should talk about that offline when we're done with this.
Yeah, for sure.
Well, and then the other thing you had mentioned is sort of like the wearables and the other data. What have you found to be sort of most impactful with those wearables that really help kind of dictate patient care, or help the patients understand what they can do to improve?
Yeah, no, well, that's one of my favorite topics. So already like years ago, we brought in HRB, heart rate variability biofeedback. So basically a device that's like basically a heart rate monitor. So it's a small device that clips on your ear or your finger to detect your pulse, and then sends that via Bluetooth to our app, to an algorithm that's like a pacer, where you like breathe with the pacer, and it gives you feedback and adjusts your breathing pace. And what that does, and what we've seen it do, like, we've done a study with Harvard on that, and we also have been like just doing it with tens of thousands of people already. And what we consistently see is that when people notice that actually they can control their own mental and emotional states pretty quickly with just their breath, and actually seeing the data, like it's not like that I'm thinking or like just believing something or whatever, like it's actually happening, and I can see it in my nervous system. It is adapting in real time as I'm doing these practices or this deep breathing. So that's something which is like really, really cool, because it then instantly shows people that you are actually much more in control than you thought. And often the story is to people that like, well, you got to take these kind of medications, or you're kind of with this label for the rest of your life, and you're like depressed, you're a depressed person or whatever. And then when people start realizing that, whoa, I can actually impact this with my own actions pretty quickly, that's really powerful. So I think that's one of the main kind of things that we've learned. Of course, like just sleep tracking, other things also are very helpful when people can objectively see that like, wow, my sleep is really improving. I'm actually sleeping a lot better, a lot more than I used to. So these are like some of the most powerful things that we're seeing.
Yeah, that's a great point. And actually, since you mentioned medications, I need to follow up on that. I mean, we haven't talked much about medications. We've been talking about lifestyle and therapy. But is this a practice that also uses medications, as in all of this is sort of adjunctive and used together, or is it sort of a one versus the other?
Yeah, we also prescribe medications when needed. So definitely we have the capability, and there are very good reasons and very good kind of situations where medication is needed and helpful. It's just not the only tool in our toolbox. It's more so that we first want to understand like what else is really going on, because a lot of these people who come to us, they've already tried a lot of different medications. And that's usually the challenge, that they come in with like, oh, I tried this and that, and it's just not working. So can we do something else? And that's why we don't like just instantly rush into like just prescribing yet another medication.
Yeah. So do you see patients who are first diagnosed with depression and never been started on anything, all the way up to people with treatment-resistant serious mental illness who've tried everything under the sun? You see sort of like everybody in between?
Yes, we do, but mostly like the most sort of like naive patients usually kind of come into the therapy program, which is for a bit more milder members. So with our psychiatric program with Meru Advanced, we tend to see people more on the kind of higher acuity end. So most of these people have already been on medications or been in therapy for a long time.
Right. So you've got sort of what you call the standard Meru program, and then the Meru Advanced program, which sees the sicker patients with more comorbidities, and that's where you get a lot more of the metabolic interventions as well.
Yeah, exactly.
Okay. And then what's coming down the pike in the future? What other advancements or new things are you trying that we should look for in the future from Meru Health?
We're always excited about innovating and building new cool things. So one thing we're working on now is just to kind of enable broader wearable integration, so that we can kind of collect different data to understand people's behaviors better, to better individualize care, and to also track progress better, or also track if someone's not progressing. That's also very important. So that's one thing we're working on that we're really excited about. And then we're also constantly looking and talking to people who are innovating in psychiatry and mental health care, in terms of like, how could we maybe better incorporate exercise, or how could we maybe prescribe exercise in a more convenient manner, or how do we just like also make the user experience good? Because it's not the tools alone that will do it. You'll also need to like really carefully understand how do we incorporate these things into people's lives, and how do, like you also said earlier, how do we make sure that people are not overwhelmed with things? So how do we like stage things so that like, hey, this comes first, and then this, and then this, and then next week something else?
All right. Well, very good. I mean, this has been a great discussion, and I'm so happy to hear about this integrative, really multimodality treatment program, because I think it's so important. And unfortunately, your brother did not have this, but just think of all the people who could have been in a similar position as your brother who might not be because of an advanced treatment program like this. So, you're really honoring his memory, and I think that's wonderful. And I really hope this can scale up, and that the system of psychiatry really understands how important this type of treatment can be and how effective it can be. So thank you so much for all you're doing, and thank you for joining me today.
Thanks so much, Bret. Really appreciate it.
Well, I'm pretty inspired to hear about the type of treatment Kristian and his team are providing for people. And, it often does take someone sort of outside of the medical world, right? He wasn't in psychiatry. He was in, I guess you could say, tech and diabetes, but not in the psychiatry world. But it took this unfortunate experience with his brother to really see things and say, what are we missing and what can we do better? And I love that spirit of what can we do better? How can we help more people that aren't being helped right now? And that's really at the spark of what Meru is, and as it continues to advance now with Meru Advanced. And I really hope his concept that he talked about value-based care, outcome-based care, that really catches on more, because that's where you're providing so many benefits, not only to the health of the individual, but the finances that will make more people want to accept that. The finances shouldn't be a barrier to people getting better, especially when it can actually help the finances as well. But I can see how insurance companies would be hesitant without, decades of data, but this outcome-based care really makes a difference. So anyway, to me, that was inspiring what he has accomplished and the offerings they have. So hopefully this was helpful to you or someone you know. If so, please share it with them. And we'll see you here next time at Metabolic Mind. Thank you for watching. If you want to see more, check out these recommended videos. Also, if you haven't already, don't forget to subscribe to our channel to stay up to date with our content and help us expand the movement. And if you want to sign up for our newsletter, access our resources, read the latest research, or check out the Think Smart framework, click here to visit our website. See you on the next video.